Welcome to Adapt NCLEX. Are you ready to tackle 10 high-yield NCLEX LPN review questions that could show up on your exams? Today, we're going to solve 10 practice questions with detailed rationale. I'm going to give you test-taking strategy and how to master this content. By the end of this video, you'll be able to master them within 20 minutes. Let's get to it. First question. How do you read a question? Read it from the back. Which action should the nurse take first? A nurse is caring for a client with chronic obstructive pulmonary disease who is receiving oxygen at 4 liters via nasal cannula. The client becomes drowsy and difficult to arouse. Which action should the nurse take first? Decrease the oxygen flow, obtain pulse oximetry reading, notify the air care provider, and administer naloxone. I will give you 10 seconds. Think about the answer and put down your answer in the comments. And then we will talk about it. We'll break down the answer choice. What do you think? Have you thought about an answer? Which one did you pick? This is the way I want you to go through the question. First, read it from the back. Which one you should do first, and then go for the buzzword, the keyword. The keyword in the question is COPD. Underline it. And the patient is receiving what? 4 liters per minute. And what is the problem? Drowsiness and difficulty. Connect the dot. A COPD patient getting oxygen now is drowsy and difficult to arouse. What do you think? There's some connection between COPD and oxygen and drowsiness. What do you think? Do you want to check the oxygen saturation, or you want to decrease the oxygen flow, or let the doctor know, or administer? There's a concept. I want you to write it down. And that concept is what? Related to a COPD. But what is your answer? And this is the answer. Number 1 is the answer. But what is the key? A COPD patient rely on what? CO2, right? So when you give them oxygen too much, you take away their hypoxic drive. High level of oxygen is a problem for them. Therefore, look at the second question. Why would you check their saturation? Patient is in distress. It's not going to help you. Drowsiness and difficulty aroused is more important than checking their pulses. I don't need to know about it. Calling the doctor, there's something you can do first. So 3 is wrong. Naloxone, where there's nothing in the question that tells you this patient had opiate. Therefore, that is also a wrong answer. Don't pick it. Number 1, down. Number 2, which motor skill should the nurse expect the infant to demonstrate? A nurse is performing developmental screening on a 6-month-old infant during a well baby check. Do you expect this 6-month-old to sit without support? Should this patient roll from back to front, crawl on hands and knees, and stand while holding onto the furniture? 10 seconds. Pick your answer choice and let me know. Put down in the comment. And then we'll talk about it. I'll show you the answer, and I will give you the concept associated with it. Which answer choices to pick? The right answer is number 2. How do you know that? This is the key. I want you to write this mnemonic down. 2 heads, right? That means 2 months, your head is up. 4 on the floor. That means at 4 months, you are on the floor. What are you going to be doing on the floor? You have to start from your front to the back. So the baby is rolling from the front to the back. That is the 4. The 6, they have to come back. 6 is what? Sit at 6. Therefore, at 6 months, they sit in with some support. But what do they have to do before they can sit? They have to roll from the back to the front. And at 8, you sit straight without support. And at 12, they're walking with some support. So the mnemonic is what? 2 heads up, 4 on the floor, sit at 6, 8 sit straight, and then walk at once. Write this down. Whenever you see your question, this is the areas they usually text. From 2 months, from birth to 12 months, you have to master that area. So that's number 2. Number 3, same strategy. Which stage is the most appropriate for this client? Read the question from the back and then go for the buzzword. LPN is caring for a 3-year-old child in the pediatric unit. When when documenting psychosocial development according to Erikson stage, which stage is the most appropriate for this client? Trust and mistrust, autonomy, shame, initiative, guilt, industrial, and inferiority. Once again, 10 seconds, read the question again, put down your answer in the comment, and let me know. This is the way you should approach it. Go for the buzzword in the question. They said appropriate, pick the right answer. Then you, 3-year-old, put the kid in the group about psychosocial development. He's talking about Erikson. Even if you don't know, they've given you some clue. You think a 3-year-old is now learning how to trust, or they have autonomy, or they're taking initiative, or industrial. What is your right answer? Which answer choice you pick? I can tell you, number 2 is the right answer. I'm giving you a mnemonic to remember it so that whenever you see this question again, this is the way you should do it. Trust all inmates in industrial and identically. This is a key. They start from all the way from the infant to what? Adolescence, mnemonic. So how do you use this mnemonic? An infant will start to learn to trust. A toddler will seek autonomy. And then a preschooler will start taking initiative. That's the inmate. And then a school age, they are very industrious. And then when you are adolescent, you have identity issue. So trust all inmates, therefore trust all inmates in industrial identically. This is the key to answering questions relating to Erikson in the first 5 stages. Very, very important. And I want you to write this mnemonic down. Number 4, which action is most important? This is prioritization. It's very important in your test. Very important that you know prioritization. A postpartum client complaint of what? Increasing perineal pain and a foul smelling loci. Assessment. Which action is the most important? That means you want to prioritize. You got to be sharp. Is it what? Assess fundal height, notify the air care provider, offer analgesic, or apply cold packs? This is the key. Once again, let's review how to go back and answer questions. You circle most important, go to the perineal pain and the foul smelling and connect this to that. Come out with your content. Don't look at the answer choice. Try to figure out what do you know about postpartum client who has perineal pain and the foul smelling loci. And then you tell yourself, what does this patient have? And then use that information to look at the answer. But which answer choice do you pick? I give you a few seconds to think about it. Think about the answer choice and the conditions I've underlined. How does it relate to that answer choice, and which one do you pick? I can tell you, number 2 is the right answer. Why? Just because there's assessment in one doesn't mean it's the right answer. Perineal pain and the foul smelling loci in the postpartum client, it has nothing to do with the descent of the uterus. Therefore, you don't need to assess the fundal height. There's a discharge coming out from the uterus, and it's smelling, and patient has pain. This is consistent with what? Endometritis. Patient has infection. Analgesic will help with the pain. It does not address what? The foul smelling loci. Applying cold packs deal with the pain. It does not address foul smelling what? Loci. Therefore, put everything together. This is how prioritization works. Don't focus on one information. If you put all of them together, you'll be golden. We are midway. How are you doing? Let me know your score. This is also a test-taking strategy, content mastering on LPN questions, critical thinking, right? Which action should the LPN take first? Another prioritization. A post-operative client has what? Blood pressure 84/50. That's your buzzword. Pause. 122. That's another buzzword. Number three, cold and clammy skin. Another buzzword. Connect all the three together. Which action would you take if you taking care of this patient who has this blood pressure, pulse, and the skin finding? Connect the dot. I said buzzword. Would you check the vitals in 50 minutes? Lower the head of the bed, notify the RN immediately, administer IV fluid rapidly. If you are in that situation, 10 seconds. Let me know what you think. Pause the video at any time. Think about it and then put down your answer. But what do you think? I can underline and lead you. I have blood pressure low, pulse is high, skin as a manifestation, and I'm an LPN. What do you think I would do? Rechecking the vitals, you think is the right thing? I can tell you the right answer is notifying the RN. Because the patient is in what? Shock. If the patient is in shock, rechecking vitals in 15 minutes, you're running out of time. Therefore, that is not the right answer. Lowering the head of the bed, you're doing something that is not going to improve the pressure anyway. Administer IV fluid rapidly, of course, but after you've notified this patient is in extremity, he has signs and symptoms of what? Shock, hypovolemic shock. We have hypotension, tachycardia, and a skin manifestation telling you this patient, we need help. You, the LPNO, cannot solve this patient. You should call somebody. Which lab value should the nurse check? Lab value, this is pharmacology using your critical thinking. Patient is prescribed what? Digoxin, reporting nausea and blurred vision. Which of these will you check? Sodium, potassium, calcium, magnesium. 10 seconds. Put down your answer, or let me know what you think in the comment section. Let me know which one you pick. Put hashtag number 6, Digoxin. I pick this answer choice. Let's break it down. Go to the buzzword and let's see what we have. Nausea and blurred vision, digoxin are a bad combination. You know digoxin, number one is GI symptoms. Patient has GI symptoms. Then he has blurred vision, visual changes. This is what? Toxic information from digoxin. Which of these findings causes digoxin toxicity? I can tell you potassium, calcium, and magnesium are all one of the things that you should avoid. The right answer is number 2, because potassium is number 1 cause of digoxin toxicity. These are all bad problems, and therefore be able to recognize that this patient is having digoxin toxicity. Number 7, which finding require immediate intervention? Same thing, pharmacology for the LPN, but in this one, there's some critical thinking. Patient has heart failure with furosemide 40 milligrams, right? Which one require immediate intervention? Prioritization. Is it dry mouth? Blood pressure of that 108/70. Patient is making urine output like a liter in 4 hours and muscle cramp. What do you think? Put down your answer. Let me think. I'll give you 10 seconds. Explain yourself in the comment section and let me know. What do you think? Let's break it down. Furosemide, what is it going to do? It's going to increase your urine output. Urine output goes up. I'm fine with it. Your blood pressure may drop a little bit. I'm fine with it. It has no anticholinergic effect. It's not the problem. Muscle cramp is because your potassium is low. Therefore, based on what I've told you, which answer choice did you pick? You can see number 4 is the right answer. And this is the indicate what? Hypokalemia. Patient on furosemide, number 1 priority is hypokalemia. And how will they present? Muscle cramp. Number 8, infectious control. LPN, place the client in what? Private room. Which client will you do? Somebody with the scabies, somebody with the pneumonia, somebody with cellulitis, somebody with Hep A. What do you think? You have to go back to your infectious control strategy and ask yourself, which one is more dangerous? Which answer choice do you pick? 10 seconds. And I can tell you the right answer is number one. Why? Pneumonia, there's a bunch of people who walk around with pneumonia and they are not isolated. If you go to the hospital, we don't isolate them. If you're taking the test and they just put pneumonia, don't pick it. But if I put mycoplasma pneumonia or I put the organism there, then you know, Haemophilus pneumonia, you know it's a respiratory problem. Then it become respiratory, right? Contact, then it become droplet precaution. Therefore, this just pneumonia, you don't know what it is. This will be a standard precaution. Cellulitis, you have to know what is in. If it's MRSA, infection on the skin, yeah. But just having cellulitis, redness on your skin is a what? Standard precaution. Hep A is also a standard precaution, unless you cannot have unless you have diaper on or you are incontinent. And therefore, number one is the right answer. This requires contact precaution. Number 9, which nursing intervention is most appropriate? This is also test taking strategy. Like I said, this is a LPN review questions. I'm trying to show you how to answer question, test taking strategy, and look at each buzzword in the question. Don't just pick the answer choice. If you pick the answer choice before breaking down the question, that's not the best way to approach questions, right? 2-year-old, and nurse is caring for a 2-year-old child with what? Croup. Those are your buzzwords. They're asking you which nursing intervention is most appropriate. Do you give them what? Cough syrup, oral fluid, cold mist humidifier, perform chest physiotherapy. Pause the video, 10 seconds, 20 seconds, and let me know what you think. I'm giving you that time. Pick your answer choice. I can tell you, number 4 is not the right answer. This is not what? Cystic fibrosis. What is the issue with Croup? The airway is collapsing. So we got to open the airway. Cough suppression will prevent them from coughing. That is bad. It has nothing to do with that. Oral fluid patient, the major problem for this patient is airway. And therefore, cold mist would decrease the inflammation of the airway, it decreases the hoarseness, and they will feel much better. These are little ways they will ask you questions, and you have to apply your content. And one of this is a classic example of how to use test taking strategy, breaking down the question. Then you see that the answer choice will pop out like a candy. This one, if I break it down, you see like the answer choice is just right there. Say, pick me. Which action should the nurse take first? Which action would you do? LPN, walk into the room of a young child with what? Tetralogy of Foley, who is crying and has blue lips. That should tell you this is third spell. If I have third spell, I got to do something. Patient is hypoxic, right? And therefore, underline my buzzword, I say what? Blue lips, tetralogy of Foley. That's all. And I'm crying. These 3 words, you got to connect it. Tetralogy of Foley, crying, and blue lips. That means I'm having third spell. I need to give the kid more blood to the lung and oxygen. Will you give them oxygen? Will you give them oxygen first? Do you check their saturation? Do you attempt to calm the kid down or notify the air care provider? You got to go to the pathophysiology of tetralogy of Foley. What do you think? The major problem when they're turning blue is because there's no blood going to the lung. We got to get blood into the lung. How do we get blood to the lung? We increase resistance, right? And that resistance is peripheral systemic resistance, and that can push more blood, right, to the lung. First, we can put the kid in the knee to chest position, or what? Calm the kid down. He's crying. The more they distress, the more they chanting. But if the kid is calm, there will be less chanting and blood go to the lung and he get what? Mixed with oxygen and the kid does better. This is the strategy. Therefore, position, knee to chest position, swallow the kid, that will chant more blood, calm the kid down, then you figure out the rest. Therefore, notifying the healthcare provider, no, the question said crying. We should let the kid stop crying. You see, in a short time, mastered 10 high-yield questions based on NCLEX concepts. If you need more content like that, subscribe to Adapt NCLEX for more content. Take care of yourself and good luck in your exams.